Sri from the Department of Biomedical Engineering. Today I will be presenting on the topic Radiation Safety in Diagnostic Imaging. We will learn how to protect both patient and medical staff while using diagnostic imaging techniques. First we see about the introduction. Diagnostic imaging is a crucial tool in modern medicine. It helps doctor detect and monitor diseases using X-rays, CT scans, fluoroscopy and nuclear medicine. However, these techniques involve radiation that can harm cells if not properly controlled. That's why safety measures are essential to protect patients and staff while still obtaining accurate diagnostic results. Next, importance of radiation safety. Radiation safety is important to prevent overexposure, which can be lead to health risks. It ensures the protection of both patients and healthcare workers. Following safety protocols also ensures compliance with regulatory standards like AERB and IAEA. Additionally, it helps maintain high quality images and lowers doses and builds public confidence in medical imaging. Next one is types of diagnostic imaging. There are different types of diagnostic imaging. X-rays are mainly used for bones and chest imaging. CT scans provide detailed cross-sectional images. Fluoroscopy allows real-time imaging during procedures. Mammography is used for breast screening, while PET and SPECT scans use nuclear medicine for functional imaging. Next one is radiation basics. Radiation is energy in the form of waves or particles. Ionizing radiation has enough energy to remove electrons from atoms, which can damage living tissue. We measure radiation in gray and sievert. Controlled use ensures that we get the diagnostic benefit without causing unnecessary harm. The source of radiation. Sources include X-ray tubes in radiography and CT, gamma rays in nuclear medicine, and scattered radiation from patients. Equipment leakage, if not properly maintained, is another source. Even natural background radiation contributes. Awareness of all these sources helps in implementing effective safety measures. Next one is radiation hazards. Radiation can cause skin burns, cancer, and even genetic mutation at high doses. Repeated exposure can accumulate risks. Poor safety practices increase these hazards. That's why proper protocols are vital to minimize exposure and protect health. Next, biological effect. Ionizing radiation damages DNA. Cells may repair themselves, die, or mutate. Are rapidly dividing cells, like those in the skin or bone marrow, are more sensitive. Long-term exposure can lead to mutation or cancer. The effect depends on the dose, exposure duration, and type of tissue affected. Next, radiation dose levels. To understand doses, a chest X-ray gives about 0.1 millisievert, an abdominal CT about 10 millisievert, and a PET scan around 25 millisievert. The public exposure limit is 1 millisievert per year. This shows why medical imaging doses must always be justified and carefully controlled. Next one is ALARA principle. ALARA stands for as low as reasonably achievable. It is the guiding principle in radiation safety. The goal is to minimize exposure to both patients and staff while maintaining diagnostic quality. This principle is applied in all imaging departments. Next one is safety control factors. We follow three key safety controls: time, distance, and shielding. Reduce the time near the source of to lower exposure. Increase distance from the source as radiation decreases with distance. Shielding with lid aprons and barriers protect against radiation. Staff rotation and monitoring further ensures safety. Next one is patient protection. For patients, we only perform imaging when clinically necessary. We use the lowest effective dose, limit the beam area with collimation, protect sensitive organs like the thyroid and gonads, and avoid repeat exposures unless absolutely needed. Next one is pediatric and pregnant patients. Children are more sensitive to radiation, so pediatric protocols are used. For pregnant women, we prefer MRI or ultrasound. If imaging is necessary, the abdomen is shielded. Always confirming pregnancy status is mandatory before procedures. Next one is staff safety measures. Staff should always wear lead aprons, thyroid shields and dosimeter badges. They should stay behind protective barriers, limit time near sources and attend regular radiation safety training to minimize risk. The next one is personal dosimeter. Dosimeters like TLT, OSL or film badges track staff radiation exposure. They are worn at the chest or collar and checked monthly. This ensures exposure remains within safe limits. Next one is room shielding. Imaging rooms are designed with lead-lined walls, doors, and windows. Warning lights outside the rooms indicate when radiation is in use. Access is restricted and proper shielding reduces radiation leakage, protecting environment. Next one is radiation warning signs. Warning signs include the yellow-black trefoil symbol and notices like cautions, radiation area, displaying dose limits and marking restricted zones ensures safety compliances. These signs must be clearly visible and standardized. The next one is role of radiologic technologist. Radiologic technologists select the correct exposure settings, position patients accurately, check for the pregnancy before scans, and maintain radiation logbooks and educate patients about the procedure. Their role is crucial for both safety and quality. Next, the role of biomedical engineer. Biomedical engineers calibrate imaging equipment, maintaining shielding and safety systems, monitor radiation leakage, assist in audits, and support the radiation protection officer to ensure safe and efficient imaging operations. Next, Radiation Protection Officer. The RPO means Radiation Protection Officer monitors staff exposure, conducts safety audits, ensures adherence to safety standards, reports to authorities, and trains all personnel on radiation safety measures. Next one is regulatory bodies. First one is Atomic Energy Regulatory Board in India, International Atomic Energy Agency, then International Commission on Radiological Protection, and last one is National Council on Radiation Protection. These agencies set safety standards. Next one is radiation dose limits. Occupational workers have a dose limit of 20 millisievert per year. The public limit is 1 millisievert per year. Pregnant workers have a 1 millisievert limit during pregnancy. Skin and hand doses are limited to 500 millisievert. These limits are based on the international safety guidelines. Next one is quality assurance. Quality assurance ensures equipment is safe and functioning properly. Regular calibration, phantom testing for imaging quality, maintaining records, periodic safety checks and preventive maintenance reduce risks and ensure reliable operations. Another one is recent advances. Recent advances in radiation safety include digital radiography, AI-based dose optimization, real-time exposure monitoring, safer pediatric protocols, and low-dose CT technologies. These innovations improve patient safety and image quality. Conclusion. In conclusion, radiation safety protects both patient and staff. Following the ALARA principle, adhering to guidelines, and continuously monitoring doses ensures safe imaging. Thank you.